I'm Arel. I'm co-founder at Cedar, and I run our Makers organization. As an innovation leader, it's critical that you build a world-class digital experience for your patients. Every day, your patients act as consumers. They engage with ride-sharing apps, with video streaming, with e-commerce apps, and they expect the same experience of their healthcare provider. Not only that, but having a world-class digital experience is a way to develop a fundamentally new relationship with your patients. If done right, you can build a positive, trusting relationship that will help retain patients over a long period of time. And that's a fundamentally different way than patients have seen their healthcare providers in the past. In our research and studies that we've done, we found that patients generally trust their doctors directly, their clinicians, but have very, very low trust in the administrative side of the healthcare system. As an innovation leader, rebuilding your digital experience is a way to build long-term trusting relationships with your patients. When designing a patient financial engagement strategy, you need to think through three things. The first is that you need to find the right long-term technology partner. This should be a modern platform that's designed to personalize the way that it interacts with each consumer based on their own pattern of behavior. The second is that you need to quantify and measure exactly what is happening at each stage of the patient financial journey. And then the third thing is that you need to constantly iterate and improve that feedback loop. So one example is that when there's a denied claim or anything unexpected happens, you should actually help walk patients through what's happening, explain it in terms that they understand, and then give them simple workflows to resolve those issues. Just like a consumer would expect using a leading e-commerce application or ride-sharing application. A second example is that the platform you use should be able to dynamically engage with patients based on their specific pattern of behavior. So for instance, if statistically a segment of your patient population engages more during certain times of the day, then you should target your messaging to them during those times of day. When selecting a patient financial engagement platform, it's vital to think about the holistic patient journey from start to finish. Before a visit, you need to accurately set expectations with the patient about what their financial responsibility may look like. Prepare them for that in ways that really aren't scary, that are fundamentally positive and trust-building experiences. Cedar has a long track record of partnering deeply with our clients. We work with innovation leaders at our clients to help rethink the patient financial journey. We have a world-class patient engagement technology platform that has been built using best practices from digital marketing and consumer engagement. We personalize every aspect of communication, from the time of day of communication to the variant of messaging, to make it as useful as possible for the users and patients that we're engaging with, and to drive the best outcomes for our partners and clients. At Cedar, our superpower is being able to iterate extremely quickly. Our platform automatically measures many different data points of how we're engaging with consumers to understand how they're reacting to every message, every engagement with them. And based on that, our system automatically learns and adapts its behavior to drive optimal outcomes. And this leads to a virtuous cycle. By constantly measuring every engagement, every touch point with a patient or consumer, we are able to adapt extremely quickly. We measure more and we iterate much, much faster than a traditional healthcare technology system to drive better results for both patients and for our partners. A successful implementation should result in three things. Number one, improved customer satisfaction. You should actually see patient experience survey feedback improve. Second is that you build longer-term relationships with your patients. You should see that through improved retention metrics. And the third is that you should see improved financial results as well. By helping to improve the patient financial experience, you should actually see improved resolution rates for bills. Patients will be more likely to pay their bills, and they'll be happier.